Good afternoon and welcome, everyone. My name is Meredith Kushner, and I'm the Marketing and Community Engagement Coordinator for the Center for Innovation in Campus Mental Health. Thank you so much for joining us for today's webinar. It's called Shared Priorities in Engaging Students in Campus Mental Health Supports and Awareness. We're thrilled to be collaborating with two of CICMH's core partners on this webinar. We have the Ontario Undergraduate Student Alliance, USA, and the College Student Alliance here with us today. Jasmine Irwin, the Director of Communications at USA, and Kira Byrne, the CSA's Director of Advocacy, will be sharing insights into what their organizations are hearing from students across Ontario and their advocacy efforts on student mental health support and awareness. As well, we are really excited to be hearing from a panel of student leaders who have joined us from their schools across the province. We have Danielle Burt from the University of Waterloo, Ali Golding from Sault College, and Chuki Ibe from McMaster University. Kira from CSA will be moderating the panel discussion, and we'll hear from all of those folks in a little while. Before we get started, I just have a couple of routine items to go over. As usual, we're recording today's session, and it's going to be uploaded to CICMH's website later this week. Also, audio for the webinar will be through your computer speakers. So for optimal sound quality, make sure that you turn up your speakers, and we recommend external speakers or headphones for that optimal sound. If you have any difficulties connecting or experiencing any technical issues, you can type your inquiry into the chat pod at the bottom left-hand corner of your screens. You can also use this chat box to submit any questions to our presenters at any point during the webinar, and we'll try to address your questions during the last 10 or 15 minutes of the webinar. And we encourage everyone to let us know who's on the line, and if you're viewing the webinar with a colleague, please let us know how many of you there are. It would be great to know what post-secondary institution you're from as well, as well as your role. So finally, we'd also like to thank the Canadian Mental Health Association of Ontario for providing technical support to us today. And now for a quick overview of today's webinar. During today's webinar, you're going to learn about some of the current student priorities around mental health support and awareness on Ontario campuses. You're going to hear some best practices and lessons learned about consulting with students, working with administrations, and some of the key elements of developing a climate that's conducive to mental health promotion. And you're going to learn some key messages to consider when engaging students in campus mental health support and awareness. The presentation slides and related resources, you'll see they're in the bottom right-hand corner of your screen in a little pod that's marked Files to Download. So you can download those throughout the presentation and follow along. And that's it for me. So I'd like to warmly welcome Jasmine and Kira to do a bit of an overview of each of their organizations. So if you guys want to start your webcams whenever you're ready.
Sure, absolutely. Hi, everyone. I'm Jasmine. I'm the Director of Communications at the Ontario Undergraduate Student Alliance.
And hi, I am Kira Byrne, and I am the Director of Advocacy for the College Student Alliance.
So we are very excited to welcome you here today, and it looks like I'm presenting first. So I can tell you a little bit about the Ontario Undergraduate Student Alliance and what we do in regards to mental health advocacy in the province. Oh my gosh, and I can control the slides. Okay, so USA is a nonpartisan advocacy group that represents students. We represent 140,000 students across Ontario at 7 member institutions that are pictured on this fun map. So primarily we are student-driven, so it's very important to us that our membership are really setting the direction and the tone for the work that we do. We do have 5 full-time staff that are based in Toronto, but the model is definitely that of service. So we are here to promote the views and the advocacy of our student members. Students that are elected typically by their constituency set our research priorities, they decide our policy priorities, and they ultimately guide all of our advocacy. And it's also very important to us that the policy that we do write is grounded in up-to-date research. Ideally, we do our best to make sure that that is Ontario-specific in primary research. We circulate a survey biannually to our students and also often do topic-specific surveys, including one this year on students with disabilities. So when we participate in advocacy, primarily we are government-facing, so we're asking the provincial government for either more funds or different policies or, I guess, things that the provincial government regulates that affect student life. But a bonus that comes from how we operate is that students obviously also share best practices with one another and take those best practices home to their home institutions and work with their administrators and other stakeholders to try and make sure that university campuses are as strong as possible. So one of our policy papers was updated just last year. That's the Student Health and Wellness Policy paper. So this is where all of our policy, or I should say most of our policy that directly addresses mental health is housed. We have 11 pages of the policy that's dedicated exclusively to mental health. So this means that those were all policies that were taken to our General Assembly, so that's a group of about 54 students from our member institutions who get together and rigorously debate and go over all of the policies within that paper. And every paper has, I guess, principles, so overarching themes that they care about, concerns, and corresponding recommendations. So this is obviously a bit much to read, but these are the resolutions that came from that policy paper in regards to mental health. So I have some kind of larger themes, and if you want to look at those more fully, the policy is on our website as well as this website, and obviously will be on the slide. The dominant themes that students voiced were the idea of trying to do a better job of providing resources to regulate the supply and demand issue of mental health provision. So obviously wait times are a huge problem, students being able to access the services that they need in decent time. Fully integrating mental health care into more holistic health centers. So instead of having siloed care, having people address mental, or service providers address mental health in concert with other healthcare providers, and also making sure that there was provincial funds available for mental health care specifically. One theme that students often are grappling with at universities are how do we make sure that we can support peer support programs and grassroots mental health initiatives, while also not discounting the need for more funds for more traditional frontline mental health support, and making sure that when we try to address mental health at universities that we're not taking an either-or approach, and that we're making sure that we are finding capacities to do both. Also related, we have a Students with Disabilities paper. Many students who may have chronic mental illness issues are looking for structural supports that may fall under the Ontario with Disabilities Act, and that's something that is obviously very important in a university context. We are updating it, and it will be rewritten in March of this year. And one particular issue that I guess is topical at the moment is the idea of whether students should have to disclose a diagnosis of mental illness to their school in order to receive accommodation. Recently at York, it was decided that at that institution it is not necessary, and it seems possible that that could be a province-wide mandate very soon. So also when USA works with mental health, we are always looking to collaborate and find partnerships. This webinar is a great example of that, working with CSA and CICMH. So we sit on the Mental Health in Ontario Post-Secondary Working Group. That is a group that's primarily practitioners and frontline workers. Obviously informs a lot of our policy and advocacy to have their on-the-ground expertise. And we are also involved with CICMH, and we sit on the executive board and the advisory council. So I will now cede the floor and let Kira talk about the College Student Alliance.
Thank you, Jasmine. So I'm very excited to be here today to talk to all of you about the College Student Alliance and our students' priorities some recommendations and successes that we've seen in campus mental health over the last few years. So a little bit about the CSA. We are a not-for-profit, non-partisan organization, and we really believe in working collaboratively with post-secondary education stakeholders and the government on behalf of Ontario college students. And we do that on 5 different advocacy pillars. We advocate for affordability, accessibility in their education, accountability, transferability in students' education, and quality. And today I'm going to focus on a paper that the CSA had released back in 2012 with 13 recommendations for not only government but institutions and stakeholders as well. And those recommendations focus on mental health awareness and service priorities that are needed to support students. So why did we want to, back in 2012, why did we start focusing on campus mental health? Well, some numbers are 18% of 18 to 24-year-olds and 12% of 25 to 44-year-olds show symptoms of mental health and addiction issues. These two age groups are actually the age groups of students that attend colleges. And this is a big number, so we wanted to make sure that we were advocating for those students and trying to get them the supports they need, but also to help create that awareness and essentially break down the silos and the stigma that mental health comes with. So today I'm just going to take you through a couple of the recommendations that are in this paper. I'm obviously not going to go through all 13, but if you want to, in the files to download on the right-hand side of your webinar box, the paper is there, so you can download it and read all of the other ones. But these ones I'm focusing are on ones that we have moved forward on, the government has moved forward on, and then I'll talk about how we've moved forward on those priorities. So the first one is recommendation 2 in the paper, and this is institutions, government, and stakeholders should work in collaboration to promote improve communications and knowledge exchange of mental health promotion across the province. And I'm not sure if you know of them, but the Center for Innovation in Campus Mental Health, lovely people hosting our webinar today, actually helped facilitate this. And this was a partnership project that started with Colleges Ontario, Council of Ontario Universities, USA, who's here today, and us, the CSA. And that was funded by the government's Mental Health Innovation Fund. And this center helps reach that recommendation, or helps to get started on that recommendation, because its community of practice facilitates that knowledge sharing, that resource exchange, that collaboration between not just institutions, government, but students, institution, and the communities. And the network of the CICMH allows for better communication of initiatives and awareness and information. So that has been a really big success in since this paper has come out, and something we've been lucky to be involved in. The next recommendation is increased levels of funding for institutions, or create incentives for institutions so they can develop support services on mental health. And we have seen the government, after this was released, implement the Mental Health Innovation Fund, which was a 3-year, $27 million commitment that ended up funding 32 projects from 2013 until now. And the government realizes that these students are still thinking that this is a priority, and they see this as a priority, that they have reinvested in it. So we'll continue to work with the center and the government to look at those proposals and make sure that those get put through, the ones that can help support our students. The next one is recommendation 12, and this one I want to really focus on kind of projects that we've done provincially, but that stakeholders must work together in a collaborative effort to raise awareness and destigmatize mental health and problematic substance use issues across the province. So our membership had really asked us back in 2012 to find a way to raise awareness for mental health provincially, not just by campus to campus, on their wellness week, but something that brought the whole province together, that made students across Ontario understand that they're not alone, that there are students that feel the same way they do sometimes, and to share those stories. So in 2013, on the third Monday of January, we introduced a campaign for the day called Blue 2013. So this was focused around the whole concept of Blue Monday, and the goals were to raise awareness about student mental health and mental illness, but to share student stories so that those students, over social media, so that those students could feel connected to students who may go to school up north and another one goes to school in Toronto, and they can understand that they go through the same thing. It was also to try and foster an environment of acceptance, safety, and comfort in colleges across the province. Like I said, just to get people talking about it and get them to understand that it's okay that you feel this way. You're not the only one, and there are things that we can do to help and again, to connect students across the province. So this was a very successful day, but our members had decided that they wanted more than that. They wanted this to be year-round. So from that, the Yellow Umbrella Project launched in September 2014, and it is now part of an ongoing commitment to mental health on campus. So we run campaigns, we provide resources all year round, all the time, and it's really been built into our model and our organization, as well as our student associations in their colleges. So a little bit about the Yellow Umbrella Project. It's a mental health and resource site and awareness campaign for colleges across Ontario. But this doesn't just extend to colleges. It extends to anybody who wants to know a little bit more about mental health and maybe gather some resources in their local areas that they need, and to just raise awareness. So the goals for this were to stop the stigma surrounding mental health, so provide that, create that environment of acceptance and comfort, provide resources to students, and raise awareness of the different issues within post-secondary education. And why did we name it the Yellow Umbrella Project? Well, yellow is actually one of the lightest colors. It's uplifting and illuminating. It offers hope, happiness, cheerfulness, and fun. And the umbrella it represents shelter. So shelter is not just from the stigma of mental health, but also as it offers shelter and a safe place for students to come and feel accepted and understood. This has become way more than a campaign that was done once a week on our colleges. It has really been ingrained in our colleges every day, our essays everyday activities. You know, students have added permanent fixtures on their campus to remind all year long their students of their mental health, to stop and think about their mental health and to say hello to one another and just be a more inclusive environment on the college campus. And it's also become a web resource. In 2015, we launched the website for the Yellow Umbrella Project, which students can now access 24/7 for any resources that they may need on their campus or in their community if they're looking for somebody to talk to or some help. And finally, the last recommendation I'm going to talk about is recommendation 13, which we really believe in. And Jasmine had mentioned it earlier, is working collaboratively on things like this, that students must also be involved in that, in the developing of initiatives and services, and they must be able to collaborate and provide input on those, because it is affecting them and it is helping them. And we have seen this happen. We have seen colleges really take our student associations, partner with them on not just wellness weeks, but sitting on wellness committees, partnering on policies that are created, sitting on student services boards to make sure that they're accommodating all students. And provincially, the CSA sits on the CICMH Executive Committee, where we get really a lot of knowledge and understanding, and the student voice is very well heard. And the Innovation Fund proposal reviews, which is great that we get to have a student's voice on what could really support our students and help them. So we really are trying now to move forward with this kind of mantra of just getting our students to stop and talk about mental health and stop and listen to somebody or somebody's story, and then just stop the stigma, to become a more accepting environment, to become more collaborative, and to make it a safe place for everybody to go to school and feel comfortable and get help. thank you. So you get to hear from me a little more. We are going to actually move right into our student leader panel discussion. So if I could get all of the student leaders to turn their cameras on and unmute their phones. Okay, great. Can you all just say something so I can make sure I can hear you? I can't hear any of you. Hello? Danielle? No. I'm good at reading lips, though.
You may need to press *6 just to unmute yourself if you try that.
How about now? Yes. And Shuki? Could you press *6?
Hi.
Hi. All right, great. So we're going to dive right into it, but how I'm going to start this panel is I'm going to ask each of you to introduce yourself, what school you're from, what your position is there, if you're on the student association, what you're involved in, and then talk about what are the biggest priorities on your campus and for your students regarding mental health and mental health awareness. So Danielle, since you're the first one on my screen, I'll start with you.
Okay. Hi, everyone. My name is Danielle Burt. I was the Student Union President for the year 2014-2015, and then I've currently been involved with the Student Union since then, as well as worked for the university part-time while I'm doing full-time studies. Do you want me to go into the priorities, or should we all introduce first? Okay.
No, do it all in one shot.
Okay. Priorities for University of Waterloo is to really be supported academically as well as mentally. So putting those two together, bridge them together so that it's not considered two different things as far as your mental health and then your academic success. You want to bridge that gap and make sure that students know that they can be supported together.
Great. Allie?
Hi, my name is Allie Golding. I'm president of the Student Union at Sault College in Sault Ste. Marie, Ontario, and I'm also vice president of the College Student Alliance. So some of our priorities, and this is something I've been working on for a few years. I've been president for, this is my second year now, is that creating that mental health resources before, like all of our colleges have counseling offices and things like that. But one thing I focused on is just creating safe spaces. We know on campus there's gyms and tracks and things like that. Like for your physical health, there's all of those resources that you can access. And when it comes to mental health, it's more your group of friends that you make yourself when you come to school. But we've opened a music room on our campus that's kind of become a safe place for students. And music makes a lot of students feel a little bit better. It's a different kind of connection that they have. And we also work a lot with our Native Education Department with mental health specifically, things like being able to access elders on campus, as well as sacred fire arbors and smudging ceremonies and things like that.
That's great. And Shuki?
Good afternoon, everyone. My name is Shuki Debe. I am a student representative with the Student Representative Assembly for the McMaster Student Union. So one epically cool thing about McMaster is we have over 300 plus clubs. Clubs with very different interests. We have a significant amount of clubs who work with us and who have different mental health initiatives that we take on. So for McMaster, specifically for our student union, we are very interested in three major parts: advocacy efforts, awareness efforts, and increasing our peer support capacity within our student union. We are working currently with a McMaster Student Mental Health Network. This brings in different partners from across different interests with different specific expertise. Our university is working on a comprehensive mental health strategy that the McMaster Student Union also participates in. We're hoping to increase the capacities of our peer support networks, giving them advanced training. We have this very cool resource called the Peer Support Line. It's one of those lines where you can call in, and there's always somebody on the line that's willing to engage with anyone who has any issues. We also have an advocacy-related week. It is called the Mac Talk campaign that we run with our union and with the university, where we try to really normalize the language of mental health across our campus. So a lot of very cool things happening. We've been doing rather well, but obviously there are a lot of limitations as we try to grow and learn every year. But I think the priority for us is to empower our students to come to the table with their own issues and give them the resources to be able to execute with the feedback.
That's great. Thank you. So Jasmine, Chuki and Ali kind of spoke to how their priorities, but also how they addressed it and different things they did. Did you want to kind of tell us how you've addressed the priorities on your campus, maybe some key steps you've taken to get where you guys are at the moment?
Absolutely. So in working at USA now, I'm a full-time staff member at this point, and I've been here for about a year. But previous to that, I worked on the Students' Council at Western University. And both at USA, so globally across many universities, but also, I guess, personally in my experience at the one university, one big priority was to try and make sure that students who are experiencing mental health issues didn't get caught up in the cogs and gears of bureaucracy or siloed institutions. So that here we call that the no wrong door policy. So if I were to go as a student and talk about a mental health issue to my academic counselor versus a professor versus a residence life coordinator, that I could reasonably expect to receive a baseline level of support and then subsequently hopefully be referred on to the appropriate service from there. So that's in our current student health and wellness policy, and certainly is a huge priority to try and make sure that that initial support and triaging system exists on campus, and that can happen through awareness and awareness campaigns. That can happen through consolidating and communicating resources, and can also happen through some baseline training for people who work at universities.
That's great, thank you. And Danielle, how about you? How have you and your team really addressed the priorities, and then maybe some key steps that you took?
Sure. So we had similar issues that Jasmine actually outlined in the mental health policy paper that they have, where students really wanted that service for mental health fast and immediate. And so what we did to help wait times for counseling services, we integrated that peer support network into a service within our student union, which is a still ongoing process. Right now it's happened organically among the students because it's such a need on our campus to feel that peer and social support while you're going through something as intense as post-secondary education. So it's a process becoming an actual service that's co-managed by counseling services on our campus as well as the student union. We also have a mental health committee within our student union where students can actually come out and at our student council and run for those positions. And what they do is bring from their networks and their support teams ideas and strategies for students to help cope with their issues, as well as events and awareness campaigns. Our university has a great counseling services team where they have student teams that go out on the ground and talk to students about different issues. So one of them is called Burst Your Bubble. So again, it's that peer support. We're always here. It doesn't have to be within counseling services where you book an appointment and have the wait times. There is a constant support network out there and really driving that home for students. And we've really partnered with counseling services on our campus to have a united strategy for mental health, which helps that we have a similar message going to students as well.
That's great. Then how do you get, and I'm going to just ask you again, as we're here to talk about engaging students, how do you get those students to take part and become peers and help other students that may need it?
Yeah, it's great, but it actually happens organically. We have quite a few student clubs who are dedicated to mental health on campus, so there's a lot of passionate student leaders, and we have some very front-facing students who are involved in things external to the university, so again, they're loud voices on campus that reach a lot of students, and then we try and hold events as much as possible in central campus locations to, again, bring those students out and say there's support here for you. Also, if you'd like to volunteer your time, here is the steps to do so.
Oh, that's great. Thank you. So, Ali, we'll go back to you. Can you just share with us some of the things that you found to be successful practices in engaging students on the general topic of mental health awareness, but also the supports that you use? I can't hear you.
Sorry, can you hear me?
Thank you.
Okay. So some of the things that we do, and we do this every year when we get our new team in our office, is that we train all of our staff in Safe Talk, which is the suicide alertness for everyone training. And this includes all of our workers that work in the restaurant that we run, which is about 40 students. And we find that this does really help a lot because even if students aren't confident in helping another student, they at least become aware of the other services on campus that can help them. Also, our full executive team, which is 3 or 4 of us, we're all trained in mental health first aid, and we do that training with the resident advisors on campus as well. We do different things throughout the year, so our Mental Health Awareness Week, Yellow Umbrella Project, things like that. And then just kind of like what Danielle said, it kind of comes naturally. In our office, we never let a student leave unhappy. So if a student comes looking for specific services, we make sure that everyone in our office is familiar with student services, and we can bring them there and introduce them to different services that they can access. Oh, I can't hear you.
I was on mute this time. Chuki, maybe you want to share just some successes in engaging students in support usage, but also awareness on campus.
So one of the biggest priorities for McMaster really and for the Student Union is Welcome Week. We have at least 5,000 students coming into campus, and that is a very key moment in capturing and really creating the narrative and creating the culture of accessibility and giving people the words to use to even talk about and discuss about mental health. So this Welcome Week, which was just past September for at least 1 week, we had a series of events. We had spoken word concert featuring a prominent Canadian poet, Shane Coygon. The event was really to draw in, and at the event, we then started with the language. We gave people the history and the context, and also the relevant that they needed if anybody needed to get any form of assistance. After Welcome Week, we had a bunch of different clubs and services on campus, from the peer support line, as I mentioned before, to the Women Gender Equity Network, which is a women and feminist-related space, student health, education committee or council, which is another peer support-related service, and also MACSAS, which is an accessibility-related service. So these 4 key services that we have in our student union, we have their own independent programming. They work independently with the different communities, and we try to work as much as possible with them to give them every single support that they need to run their programming. So we've seen a lot of success with that. I think mental health and McMaster is now something people easily talk about. And the language has really come into fruition and taking front and center. Mac Talks is another campaign that we have in February in our university. It's a partnership between our student union and the university. It's a week-long programming. We have art displays, choir performances, really big events to draw people in. And once we get them in, and then we start giving them the messages. We also have mental health first aid that has been initiated by our university. So every single frontline staff receives mental health first aid. It's far from perfect, but the point is to give frontline staff the resources and the language to talk about it, to identify people, hopefully identify people who might need help, and to give them the appropriate resources where they can go to seek more help. So those are some of the very cool things that we've been doing so far. The university is trying to revamp its accommodation policy to work more with the student accessibility services to make sure that students don't have to disclose if they ever need accommodations from professors. So the student accessibility services does all that for the students to provide and protect their autonomy. We have another very amazing group on campus, the Hamilton Math Student Coalition. They are a very privately run organization. They have events throughout the year to really support people. They're extremely confidential and invite people to come in who have mental health difficulties to keep that confidentiality going. So really, our priority is first of all to work first of all with people who have different mental health issues, and to make sure that they are running the events, they are running the programs. As an institution, we just really step back and say, okay, what do you want to do? How best can we execute? And what resources can we provide you to be as successful as you want? And there has been a lot of, as I mentioned before, a lot of good things that have come out of this, but we are still in the learning process of getting feedback and always revamping and always reanalyzing and building for the future.
Great, thank you. And now we'll go back to Danielle, and I'm going to get all three of you, Danielle, Ali, and Chuki, to answer this question for me, but maybe you will share with the group what challenges that you've seen in engaging students or from the institution or from any other party when you're trying to raise awareness on mental health and get students to use those supports or know that they're there for them.
Yeah, that's a great question. Students often bring to me the concern that it seems to be more of a one-day thing a year. So we have a mental health day on campus, and a lot of students are saying, why can't we have this all year round? And I think that says to us that we need more work on awareness on our campus because we do have services that operate year-round, but students aren't always aware of those and how active they actually are. So that's a concern that we have, that students say, okay, we need to be more active throughout the entire year. So that's the goal that the university has taken on, as well as the student union, to make that message be year-round and not just a one-day campaign that it often seems to be. It's just that campaign seems to be the most public and wide-reaching. So again, the students who don't normally see the action in close quarters, they see that big campaign that once a year. And then another issue that we often have is that we don't just need awareness, we need action. So students, it's great to talk about mental health, and yes, the stigma is quite a bit less on our campus now than it was in the past, but then that needs to lead to action to have increased services for students on campus, as well as more events, more communities, more networks that are talking about this and advocating for students to have a better mental health environment for them to be learning at their best academically. And so those are the concerns which I don't think we should ever stop trying to work on. I think that there'll always be concerns because we can always do more. So just continually telling students that there are services year-round, that we can help them, whichever their needs are, we can direct them into the areas that they need.
Great. Chuki, what are some challenges that you've seen on your campus?
So a couple things. So we offer a plethora of incredible services. I think each service does phenomenal work. A major challenge that, this is something that I personally advocate for constantly, is, so I'm a first-time international student that came from Nigeria 4 years ago to study here. And for me, the language of mental health was something that we never used. So there's a huge culture shock learning the language and learning the discourse. So what we find now is there's a significant population of students who actually are not even acculturated to talking about it or to thinking about it. It's not even something that comes up in mind. So it's creating campaigns, creating policy, or creating awareness campaigns that fit the general student population, but also recognizing that we have niche populations on campus that need specific programming to go towards them, and working with their leaders to create the programming that goes towards those specific programming. But over the past couple of years, we've had some exceptionally successful campaigns. People know where the resources are. People know how to use the resources. But then the challenge then becomes when we try to access those resources, we still have exceptionally long waiting lines, exceptionally long booking times. So you go in to find a mental health resource. You want to be able to speak to a counselor. You get an appointment, but the next appointment you can get is almost 3 months, 4 months later. For people who are under a lot of crisis issues, this is really unacceptable for them. They need the help once they need it, and as an institution, we should be able to provide that support as often as we can. So those are some of the challenges that we're facing right now. We're working to expand capacity and to create those niche programs for niche communities across the campus. So we try to do that through the mental health student network that we have, bringing different partners, people from the community to work to create niche programming and to expand the to reduce every kind for students.
Great, thank you. And Allie, how about you?
So I think our two biggest hurdles that we have to make with mental health is one, that it's unfortunately still stigmatized to come out and say that you are dealing with mental health. Even though everyone does at some point in their life, it's unfortunate. And then also, a lot of students aren't made aware of the services on campus until their mental health has become an issue, until it gets to the point where they're saying, I don't know what I can do anymore. So I just think finding a way to communicate with students that these services are on campus and there are people in any department that are willing to talk to the students and help them get to where they need to be. Especially students, they deal with a lot. They have a lot on their plate, and I think that it should be easy for them to access those services. And like Chuki said, that sometimes when you make a counseling appointment, it can be like a month or more before you see someone, and not necessarily the first person you see is going to be the right fit for you either. So sometimes it takes a while to be comfortable with the mental health services on campus. And I mean, students are only here for about 2 years, so we have to kind of reach out to them as soon as we can.
Yeah, getting communication, break through all that noise of all of the different information they're being shared is definitely a challenge, and I know everybody seems to face it. Jasmine, I'd be interested to hear from you on at a higher level. So it doesn't have to be from campus to campus, but when talking to stakeholders and talking to government and talking to your members, what are some challenges that you've faced or you've seen provincially when it comes to mental health awareness and support usage?
Yeah, absolutely. So I think one challenge that we face when dealing with provincial advocacy is the idea that services can vary so widely between institutions. And obviously, universities are familiar with their own communities, and there's a certain amount of specialization or adaptation that is necessary in dealing with specific communities. But for the most part, one university's mental health services actually can look quite radically different than another's. And when you're trying to present a kind of a united front or a comprehensive strategy, that can be difficult because your advocacy ask may not be a good fit or make sense for the institution in question. So it's something to be aware of. However, the flip side of that is that we find that our students do really well at sharing their experiences at their universities. They'll often talk about what is working at their schools, what isn't working, and hopefully they're able to take away things from those conversations to bring back to their home institutions and hopefully bring the best of what's there. And another issue that we deal with provincially is just making sure that the funds are available for universities to access if they need it. Obviously, when you're dealing with mental health services as one piece of a puzzle of a university operating budget, I feel that too often those kinds of services are seen as ancillary. So when decisions need to be made, it's often frontline services or those kind of extra services that can suffer the brunt of cost cutting. So we need to make sure that there are buffers in place provincially to make sure that if there are fiscal issues, that students aren't suffering who need desperately to have access to these services.
All right, absolutely. So I want to give enough time to ask some Q&A. I see some Q&A questions popping up in the box here, but I do want to just get one more thing in, and I'm going to have all 5 of us actually answer this question. And we'll start with Chuki this time. But if you guys could just share 2 key messages that you would want this group on this webinar, so these 51 lovely people that have joined us today, 2 key messages on engaging students on the topic of mental health. So Chuki?
To be as frank as possible, bureaucracy has its limitations. And often I find people who want to access resources, especially students, are just drowned in so much bureaucracy. So something that seems very straightforward It's filled with so much paperwork, filled with so much unnecessary process. So we need to find very innovative ways to, first of all, respect the benefits of bureaucracy, but also limit I guess, some of the redundancies that do exist. The second major thing that I want to say is there are so many different communities across at East McMaster. And for us, something exceptionally key is to find the leaders in those different communities and then give them the language and give them the tools. And then they will interpret those tools in the best way to fit the demographic they serve. So it's provide those student leaders with the resources and literally just watch the magic happen. But it's initial to find them and to empower them and take away every single bureaucratic redundancy that they have to go through to make sure that their communities are as viable and lively as possible and are accessing those resources that they need.
Great, thank you. And Allie, what are your two key messages?
I think my key messages would be talk about it before it's an issue. All students deal with mental health, and it can be good or bad at any time. So I think talk about it before something happens. And then also just engage with your student services department. They're there for a reason, and they are armed with all of the services to help the students really at the end of the day. And we can advocate for their services and increase them, make them better. But it's that communication channel with them at the beginning that'll really gear all of us to better help our students.
Great, thank you. And Danielle?
Yeah, what you both said is great points. And I would just add that if you're doing an awareness campaign or doing some sort of project to get out or to outreach to students, to really put an emphasis that it's ongoing, that it's not just that single campaign or single effort, that it is something that is trying to support students on an ongoing basis. And then from there to track the progress and reach of that campaign or project or initiative, because I know oftentimes we do these great things as student leaders and as staff members of the university, but then we don't always know how we did with students who are actually in need of the help. So just encouraging that progress and check in with students to make sure that you're actually identifying with the audience you're trying to reach. And then the other thing that I would say is to try and, Chuki said it a little bit, to bring it to the student venues. A lot of times we have the awareness posters and information within health services, within counseling services, but it takes the students to get there to actually reach that information. So sometimes it's bringing the information to the environment that they're in all of the time.
Great, thank you. And Jasmine, what are two messages you'd like to leave with the group?
Well, I would certainly echo everything that everyone has said so far. I think they're really great points. Something else I would add
So I just thank you to the four of you for answering all of those questions. And I'm now going to turn it over to
to improve my campus to engage students and help them with their mental health struggles. So is there anyone that wants to try to answer that? So they're looking for concrete ideas about how to actually engage students. I mean, you guys have provided lots of tidbits already, but if there's anything burning.
If I can just quickly answer. I obviously don't know the person's asking the question, but I think one thing that I've seen in my student leadership experiences are people are trying to always create new things, whereas there are a lot of things that already exist. So I think the task is then to go and survey the area and find out what people are already doing, and then just find ways to augment the resources that they already have. If you're giving them financial resources, please do. If you're training people, please do. If you're training specific leaders to then train the rest of the people, please do.